and it will be posted to the meeting invite that you've all received, as well as to the AfriHealth website. And then shortly later in September will be posted to the Stripe website itself. All right, so without further ado, I'll begin. And today we'll be covering two new modules. I'm very grateful to have the two teaching experts, Judy Cagnola and Elsie Kujuli Molwadi, joining us to talk about two of the modules. Before we do that, though, what I would like to do is review with you just one aspect of the modules, and that relates to the quality improvement approach to teaching that we hope to incorporate into many of the modules. So I think most of you that were in Lagos and those of you that have joined the last couple of modules are aware that across this curriculum, we hope that learners will understand the importance of quality improvement, and we hope that they will be equipped with a few tools so that when they go out into clinical practice, they are able to engage in quality improvement. We recognize that many of these learners have not done quality improvement in their professional practice at the point that they take these modules. In fact, many trainees are only just getting into their first clinical experience when they participate in the training. So the idea of teaching QI is really to give them a framework and a vocabulary for thinking about how one does quality improvement, rather than expecting them to become accomplished experts at quality improvement. And so with that in mind, what I wanted to do now is just briefly give you an overview of one particular approach to quality improvement, the PDSA cycle, that we're hoping that your trainers will become adept at teaching, and students can thus take away and learn. As I mentioned last week, that there are many different QI tools that we are incorporating into the modules, and this is just one example of a QI tool. And just by way of recap, all of these modules we anticipate lasting about 90 minutes, being taught in a interprofessional framework with learners from different professional cadres, taught around an individual specific case scenario that leads to a teaching opportunity, the teaching being mostly done around team-based care, problem-based approaches to learning, and into that case-based opportunity. As I hear later, when Judy presents the case, we want to bring in some quality improvement approaches. So I think many of you that are practicing as health professionals are familiar with the PDSA cycle, the plan, do, study, act cycle. And so I don't want to spend too much time talking about the mechanics of how one uses a PDSA cycle. But essentially, it's a framework for addressing a particular issue, often an issue of where there's a problem of poor quality, or a failure, or a gap in care, or where there's a hunch that you think things could be improved. And learners are asked to think about what are we trying to accomplish? What will we know is a change in improvement? And then finally, as they act upon it, what change can make that result? It can lead to a change that leads to an improvement in care. And so as your trainers teach this process to trainees as part of the Stripe learning modality, the idea is that your trainers can communicate to the learners some of these key elements. So, you know, in the case that Judy will present later on the needle stick injury in a junior member of staff, you know, the idea is that there is a problem here with the quality of care that leads her to stick her finger. And so the idea is, what could it be done to prevent the individual from getting the needle stick injury? And then, you know, in that particular example, we asked the learners to think through what are all the steps that could be intervened upon to enable safer delivery of care. And then through working through that particular vignette, we encourage them to think about how could you test whether your specific intervention makes a difference, and then evaluating that impact whilst addressing issues that would otherwise prevent implementation. And so I think, you know, obviously for the purposes of this module and overall the approach to QI that we are proposing in these modules, we really want to highlight a few key elements of QI so that learners understand that it's achievable in their clinical practice. So importantly, you know, we want trainers to be able to communicate to learners that using the PDSA cycle in this setting does not require huge numbers. They don't have to recruit huge numbers of patients or clinical scenarios, but it does require some key elements so that, you know, for it to be effective, there has to be a measurement of impact. And there has to be a cyclical nature to it. So, you know, testing whether some intervention has improved the level of care, and this is done over an iterative process involving collaboration, often across professions. A key element to QI, as all of you know, is that this is not a research endeavor, and as such doesn't necessarily need a committee approval. But it is important that all recognize that improvement in the end is not the goal, rather than designing improvements that can be sustained over time is the goal. So all of that to say, as you think about the applicability of the PDSA cycle and these other QI modalities to strike training, I think the key goal is that the trainers understand these concepts so that they can inform how the learners think about them and provide the learners with a vocabulary for using these, or for thinking about these tools in their clinical practice. I think the next step then, and this is beyond the scope of the strike training, is to think about how these approaches can actually be incorporated into the learning experience for medical, nursing, pharmacy students, and then how can they be taken to scale across, you know, clinical settings, in particular high HIV burden settings. And that's not something that we'll address now. I know that many of you are thinking about that in your own strike projects, but that's something for everybody to consider moving forward. And obviously, I think that, you know, the goal of this PDSA cycle is that students learn a culture or an approach to improvement that can be sustained over time, so that there is continuous improvement in an element of care, whether it's related to reducing the risk of needle stick injuries, as is discussed in Module 6, or some other aspect of clinical care. So I think I've talked enough about this. There are many training resources for teaching QI. And so for learners at your institution that want to learn more about teaching QI, I can certainly share those over email. They are linked to, some of the modules include references to those in the reference section. And several of the modules include other teaching resources for QI. But if any of your trainers want to know more about QI, then there are some great resources out there. And so specifically in South Africa, the IRM Institute has some great resources. The Institute for Health Improvement, IHI, has some great resources, both of which you can access over the internet. and may be useful for your trainers as they prepare to teach this content in the modules that they are teaching on. So without further ado, I think I said on this subject. I'm going to pass the virtual microphone here over to my colleagues Elsie Kajuli Mawadi and Cheyenne Martin, who are going to lead this next section and talk about Module 5. So let me just unmute their mics. Cheyenne and Elsie, can you hear me?
Yes, clearly.
Great. So I'll pass the mic over to you guys now.
Thanks, Mike. So Mike said Elsie will begin by presenting Module 5, Care of the Adolescent Girl at Risk for HIV. And Elsie, if you just want to let Mike know when to advance the slides, and I will help move you along.
Okay, thank you very much, everyone. Good evening, good morning, and good afternoon. It's raining quite heavily in Kampala, and so there's some background noise. I hope it's not disrupting the session. But also when it rains, the internet sometimes becomes unstable. So Shane, if you find that you cannot hear me, please take over. So as
okay, sure.
Thank you. So we are going to talk about Module 5, the care of the adolescent girl at risk for HIV. Next slide. Next slide. Okay, so just to give an overview, the goal for this module is to prepare learners to recognize the unique aspects for caring for adolescent girls at risk for HIV, and also to provide team-based care for the adolescent population. And the overall objectives include, we are using a case of vaginal discharge in a teenage girl. So we will describe the evaluation and management of vaginal discharge, list the factors that increase adolescent risk for HIV acquisition, and also discuss a non-judgmental strategies for taking a sexual history, and recognize why young women or adolescents may engage in high-risk sexual behavior. And with this, we use the objective is to use a multidisciplinary approach and describe the strategies for HIV care continuum to prevent HIV in adolescents specifically. And also we'll continue on one of the other objectives is to recognize implications of gender-based violence and discuss ways to assess for GBV. Next, please. Next. Okay, so the module case is, we will use Mary, that is a 17-year-old girl who presents at the outpatient department complaining of vaginal discharge, which she has noticed every morning for the previous week. And she lives with her grandmother, who is unable to pay for her school fees. So as a result, Mary goes out with an older man who financially supports her. So he provides her with some pocket money and other niceties. So that is our case for Module 5 to meet those objectives that we outlined earlier. Next, please. Next slide, please. So just an outline of the map. As Mike said at the beginning, this will be about 90 minutes. So 5 minutes is given to introduction of the team. The facilitator will give a chance for everybody to introduce themselves, probably give just a little about their background, and then go on to a discussion about the management of vaginal discharge. And this would take about 20 minutes. Then they will list the factors that increase the risk of HIV for adolescents for about 5 minutes. And the next 10 minutes, they will discuss the strategies to take a non-judgmental sexual history. The next 15 minutes is to discuss the strategies to increase adolescents' engagement and retention in care. And all this is not cast in stone, but as facilitators, you know how to go about it, because some may overlap, some may take a shorter time, some may take longer. And then the gender-based violence will be discussed for about 10 minutes, including a short video. And then we'll give some 5 minutes for a conclusion. So this is about, in a nutshell, about 90 minutes. The next slide, please. Next slide. Next slide, please. Okay. So what are the key questions? What learning methods are we employing? And what core content are we trying to communicate? And these are the things that will be running at the back of the facilitators. And talking about the essential IPE tools that will be deploying as we are having these discussions, ensuring that everybody participates, ensuring that nobody dominates the discussions, and making sure that everybody is comfortable to take part in the discussions, and also considering the QI methods or domains that are addressed in the new module. And some of this has been talked about by Mike at the beginning of the webinar. So let's continue to the next slide. So as facilitators, we'll be thinking about these key questions and making sure that we are addressing them. Next slide, please. Next.
So Elsie, the remaining slides are the background slides for this module. If helpful, you can walk through these, but these are really a resource for the trainer, right? In terms of looking at certain aspects of the slides. Do you want me to review those for you?
Yeah, I just thought we don't really have to go into them, but just for the facilitators, that these will be in our guides, and as the students, as the learners, we don't want to call them students, as the learners discuss, this will help us to guide them and facilitate the discussion. And I like the way they've been put into the two titles. And we'll find that because this discussion, they will be maybe throwing them out, not in this order, but as facilitators, we could help them to list them in the various aspects. So these will be in our guides, and they will be just to help us facilitate and make sure that everything is included. And depending on our expertise, these guides may be very useful if you are not a content expert, to help us facilitate. Okay, let's go to the next one. Okay, still for if we are discussing obtaining a sexual history, those are the things that we'll be looking out for. And just giving an example of the second one, confidentiality and privacy concerns, like making sure that when the learners are discussing, they discuss the issue of patient privacy and how to ask questions that to ask questions in such a manner that other people do not hear the questions, that there's privacy for the client. Those are things that we would like to bring out as the facilitators and make sure that the learners actually discuss these. So they will be there for us as a guide. And before we go on into the training sessions, we'll have these guides and would have gone through them to make sure that we facilitate the discussions efficiently. And I think I'll stop there and hand over to
Thank you.
Shayan.
Thank you, Elsie. If anyone has any questions, you can chat them, or you can put them in the chat box. And since there aren't any questions at this moment, we'll move on to Module 6, and we can return to questions at the end. So module 6 will be presented by Judy, and it's the case on post-exposure prophylaxis, or PEP. Judy, can you test your volume, please?
So good afternoon, everybody, or morning, depending on which part of the world you are. This module is looking at post-exposure prophylaxis. So whilst the other previous modules have been looking at the care that health workers give to sick people who come to us, this module is looking at the care we give to each other as a result of the injuries we may get or we are exposed to or at risk for in the workplace. Next slide. So the goal of this module is to prepare learners to assess and manage any colleague who presents with a potential work-related exposure to HIV. The main aim of this session is really to look at healthcare professionals caring for each other's physical and more so mental health, and highlighting also the interprofessional competencies. This module has 6 objectives. Objective number 1 is looking at identifying an occupational exposure to HIV, or what is an occupational exposure to HIV, recognizing the psychosocial impact of the occupational exposure to HIV on the health professional. Whilst we know, the statistics and the guidelines, and globally the exposure to HIV through, occupational is quite low, the potential is there and the risk is there, and it's critical for us, especially in this part of the world where we are very pressed and oftentimes working under very, shortage of staff and shortage of equipment and so on and so forth. This exposure is quite real. Objective number 3, discussing the risks, occupational risk of acquiring HIV amongst us health professionals, and how to perform a risk assessment for an occupational exposure. The 4th objective is describing the PEP regimen. This, of course, will be in line with your country guidelines in your different countries. Every country has, a slightly different guidelines. So we need to look at your country guidelines, look at the global guidelines, WHO, other global guidelines, and develop a PEP regimen. And then in addition to that, obviously developing a follow-up plan for managing this exposure. And then look at how optimal interprofessional communication and role clarification can reduce the risk of occupational exposure to HIV. And here we're really looking at the critical IPE competencies that we can begin to model and begin to work and begin to understand and begin to practice that can reduce this occupational exposure to HIV. And lastly, demonstrate the use of a PDSA framework, which I believe Mike must have talked about at the beginning of this session, that is looking at a plan, do, cycle to identify the interventions to reduce the risk of occupational exposure to HIV. Next slide, please. So the case module is of Mariamu, who is a 23-year-old nursing student undertaking her clinical rotation at the district hospital here in Kenya. She's been working in the antenatal ward for the last week, and as she's reinserting an IV line in a pregnant woman who is receiving blood due to severe anemia, she pricks herself. And the patient is HIV positive with a plasma HIV RNA viral load of 30,000 copies per ml. Next slide, please. I'm not sure at this point what has been said with the other modules, but again, for this particular STRIPE HIV, the modules have been presented in a way that perhaps, for example, this module is specific to Kenya context, but as you begin to use the materials, you can modify the cases to really reflect your own environment and what is real, so that it's actually very real to the students as you teach them. So then the module map, we have, an introduction we have a discussion, we have what we call the learning tables, where we are going to discuss various things, and then we also have the PDSA cycle that we'll discuss, and a conclusion. Next slide, please. So the key questions, just like the other modules that have been presented and what Dr. Elsie presented earlier, what learning methods are we employing? What is the core content that we are trying to communicate? What are the essential IPE tools we are deploying? And are there QI methods, domains addressed in these modules? So when we look at the first questions, the learning methods really that we are employing, we are really looking at having a team-based approach to learning. We are looking at also self-learning. So you'll find that at the activity tables that have been put forward for these modules, students will actually have to sit around the table with just a skeleton and find out information for themselves to get information. So we're really, I think, the aim of this is to emphasize self-learning, self-directed learning. We are emphasizing also a team-based approach, and we are also emphasizing facilitation, where the students are able to really learn for themselves, and the facilitator really plays a role as a facilitator rather than a teacher. The core content that we are really trying to communicate here, apart from the science, which is looking at the actual PEP regimens, is more looking at the psychosocial support we should be giving our colleagues in the workplace as a result of this occupational exposure to HIV. And the other content, of course, that we are trying to make sure we bring forth for facilitators is to find out a point for escalation of care, because oftentimes as health workers we may hide some of these incidents when they happen to us, or perhaps fear taking it forward. And so it's for us as health workers to see the signs that will point to the need for escalation of care within our colleagues. So looking at pointers, for example, if you see your colleague is, signs of depression, for example, they're not engaging as they would, is to be able to see, do you really think this is a point where I think I need to speak to a supervisor or get some external help, or support my colleague perhaps to go for, further counseling, and so on and so forth. Because as we know, and I think has been discussed in previous webinars, HIV, as a result of its mode of transmission, is a disease that oftentimes is not easy to talk about. And so we really need to be able to help our colleagues to take care of themselves. The other thing perhaps I'd like to point out here for us as health workers is also to realize that occupational exposure to HIV also affects non-healthcare workers. So for example, the people who we work with in the wards, the porters, the cleaners, the domestic staff, and any other non-health professional that may come in contact with needles and sharps, that we also need to be able to support them and have a framework within the work environment that supports these cadres as well. When we are looking at IPE tools here, we are looking at role clarification, we are looking at decision making, we are looking at shared decision making, we are looking at a team-based approach. So we want to deploy these tools and really to model these tools so that healthcare workers begin to work as a team. And then the QI methods, of course, that we are looking at is the PDSA cycle that I believe was discussed earlier. Next slide, please. Good, done.
Thank you, Judy. So if there are questions for Judy or Elsie, we can take them. Just put them into the chat box. And while we wait a couple minutes for that, Mike, do you have anything else that you would like to say?
Thanks, Ian. First of all, again, thanks, Judy and Elsie, for your contribution. What others on the line may not appreciate is the huge amount of work that Elsie and Judy and others put into creating these modules in the first place. So thank you both for your sterling efforts on this front. Something that Judy mentioned that I want to kind of come back to is the idea that these modules are themselves adaptable, and we recognize that there's an important role for quality improvement in the use of the modules. So as you review these, as you look through them and roll them out in your own settings, please let us know what works, what doesn't work, what needs to be changed, so that we can feed this back to the wider group. Many of you, and we're deeply thankful for this, sent through edits or comments on the modules last Friday, and we are now working through those and incorporating many of those into the modules, with a goal of getting the next draft of the modules, draft 2.0, out to you by the middle of September. But beyond that next draft, we expect there to be continuous edits, and so keep sending us your feedback as you use these in your settings. As Cheyenne said, any other questions at all? Great.
Sorry, Mike, just to clarify, apologize because I came in slightly late, and I do really apologize. Perhaps it's just to find out if the PDSA cycle was, sort of talked about a little bit in detail.
Yeah, thanks, Judy. So I did talk about the PDSA cycle at the top of the webinar, and my sort of goal in referencing it was really to make sure that the trainers are familiar with this, that they know how to use it, that they have a framework for thinking of its utility in clinical practice. But with the reality that many of these learners will not have used QI in their clinical practice thus far. And so we're hoping that this is an opportunity to give them a vocabulary and an understanding of this tool, this resource, that they can then take into their clinical practice as one of many different arrows in their quiver that can all serve to drive quality improvement.
So I think maybe it's just to add that for the QI that you see in most of the modules at the end, as a last objective, is that the facilitators, perhaps if these particular QI modalities, whether it's a PDSA cycle, whether it's a fishbone diagram, or whatever QI initiative they use, is if they're not familiar with it, is perhaps to work towards familiarizing themselves with it. When I did this particular module, I did pick out quite a number of references, which I believe are at the bottom or within that, the manual, that facilitators can familiarize themselves better to make sure that they're very, very clear on what the QI is before they go out now to take their students through it. And I do agree, most of us are not very familiar with the QI, so really as a facilitator perhaps is to take some time prior to the modules themselves or to delivery of the modules to familiarize yourself very, very well with the PDSA or the QI framework. Perhaps Mike is to ask here if there's opportunity for facilitators within, the HIV, the Stripe HIV family, to reach out to any of, as we are doing this webinar. So, module 6, for example, was done by Judy. Module 5 has been done by Elsie, perhaps to reach out to get further help. I'm not sure if there's something in there, but that can be something that they sort of having us as, resource people to help them make sure they're very clear on this before going to the students. Thank you.
Yeah, Judy, that's a great point, and one that I would echo. If there are questions about any particular module where you think it would be beneficial for your trainers to speak with the module writer, then just email stripehiv@ucsf.edu, and we can put you in contact. And I think even just a quick conference call with Judy on this module might be helpful for some of you, and we want to make sure that's available. Similarly, for any of the other modules, if you have questions, send them to stripehiv@ucsf.edu, and we can direct your questions to the correct person. Thanks, Judy.
Perhaps I also want to add one last thing here, especially as we begin to roll out this work and make sure that we really get the IPE content out, is if we could have a database, perhaps, Mike, of the different professions. So, for example, I know the team that developed this. So I know that Elsie is a doctor, I know Fred is a doctor, and I'm a nurse. But maybe the wider group may not know. As I'm giving some information, for example, as I do this module on PEP, I may want to talk to Fred, for example, regarding PEP regimens and so on and so forth. If that could be availed to the team so that they can sort of see the different cadres, so that we can get the expertise from all the cadres to really be rich as we deliver the module. So if you need some nursing information and you're a doctor, you know who to reach out to. If you need some medical information and you are a pharmacist or a nurse, perhaps you can also reach out to that. I just wanted to add that as well. Thank you.
Judy, that's a great point, and I can certainly, share around like the different cadres of the people that work the modules. Maybe on the next webinar, I'll make that that resource available to everybody. Thanks for that suggestion.
Thank you, Judy, and thank you, Elsie, and thank you, Mike. So if there are no other comments, we can end the webinar today. So next, we'll resume in 1 week with Module 7 and Module 8. Module 7 is care of the patient with HIV and cryptococcal meningitis, and Module 8 is management of sepsis in a person with HIV. So thank you, everyone. And we will talk next week.
Thank you, everyone.
Thank you so much. Thank you, everybody. Have a good evening. Bye.
Thanks, everybody.
Thank you. Thank you so much.